worked at that business from October 2nd to October 15th. Shigellosis is a contagious disease. It is transmitted person to person. And we remain concerned that this employee may have handled or served food while they were infectious and could have infected those that ate at the facility. So anyone that ate at Urbane Café between October 2nd and October 15th may have been exposed to this contagious foodborne illness. And they should watch for the development of symptoms through October 18th. Most of the symptoms are pretty typical of foodborne illness. Fever is a common, because it's an infection, a common symptom. Diarrhea and stomach cramps that follow shortly after consumption of the food, usually 3 to 5 days following consumption of the food. We are encouraging anybody that has symptoms or has a compromised immune system. It could be some individuals that are pregnant or young or old or have some other reason for a compromised immune system to seek care through their healthcare provider. I will tell you that this individual was, we received notification that this individual was found to be positive for shigellosis back on September 17th. And on that day, we excluded that employee from working at that facility or any other facility while they were contagious. Unfortunately, in spite of that enforcement order that was issued to the business and to the employee, that employee was found to be working from October 2nd to the 15th without being cleared by us and potentially was infectious during that period. We have worked closely yesterday and today with the owner of the business and their HR director. They have been helpful, very professional, and assisted us through this investigation. They are implementing some recommendations that we have made, but it's important to note that the business, the restaurant, presents no ongoing threat. That employee has been removed for certain, and although we're looking into this further to make sure that there are no other ill employees or potentially customers that are reporting illnesses, we have no information today to say that there is any ongoing risk. We still want to watch for the development of symptoms, but the facility remains open. They had a great score when they were first inspected in July, a good inspection. So our intent is to work very closely with them. They've established an 800 number for concerned customers, and they have some contacts for the media for you too. Do you want to talk a little bit about that?
Yeah, and so Urbane has developed a hotline for any residents that are concerned and would want to call them, and they want to speak with residents. They encourage them to call their hotline, and that would be 1-888-648-1615. So any residents that have any concerns, Urbane Café has asked us to give that number out as a number that they can call and ask questions.
I think we've covered all that we wanted to make sure we got out. Kim, did we miss any piece to this? Any additional comments?
Yep, the big one. If you have
to lean in. They
sorry.
want stuff.
The biggest concern, the obvious reason why we make this public is if you develop symptoms or if you have been ill and you have been exposed at this location at these times, then you may want to seek health care. Shigellosis is caused by a bacterial illness, so you may need antibiotics. Your healthcare provider can make those decisions, but we just want to encourage people to seek health care if they have been ill.
What is the window of how long you're contagious? You may have said that earlier.
A person can have symptoms and they can be contagious for days to weeks, depending on the person.
And were you guys made aware of this person through their own doctor's visit, or through here at the health department, or?
So both. So we received notification from a healthcare provider that this individual was positive for this illness. Based on his sensitive employment, working in food service, we then take action to preclude that employee from potentially passing it through food. Subsequent to that, we were made aware by a complaint that this individual may have been working during that period. That was received on Monday, and we investigated it on Monday and Tuesday, and we're finally able to confirm he did in fact work at that location for that length of time, the 2nd through the 15th.
So are there certain red flag diseases that doctors are either
Yes.
inclined to or required to report to you guys, like in this case?
By law, by California legislation, there's a list of conditions that both healthcare providers and laboratories are required to report to the health department. This is one of them. Other ones that you hear us talk about are probably many of the other ones. And so that process is ongoing. We have other cases of this and other types of illness that get reported to us all the time. The difference is when you have a person with a known communicable illness who works in a sensitive occupation or setting where they can further expose members of the public, the health department then takes action to ensure that that person does not return to work until we know that they're no longer communicable.
What is that window for being communicable?
It depends on the illness and their type of work. So for something that is a diarrheal illness, we actually have to test samples until there is no more bacteria found in it.
And again, that can range in duration significantly. Kim has talked about days to maybe weeks. For other illnesses, it's even longer.
Okay. And we'll move forward for them. You guys follow up in the next week or two? Or
They're not currently shut down.
They're not.
So they're not. They do not present an imminent health risk. We are convinced that at this point they've taken the appropriate action. We are obviously concerned about the past action, but that has been remedied, and we have had some pointed conversations and repetitive inspections so that we feel confident that there is no risk today that we're aware of. Okay. Thank you. Grant, tell me when I'm off.